on dating and sexual abuse. So first I want to start off with talking about some facts and why this is such an important issue for us to discuss with our young teens. Nearly 1.5 million high school students nationwide experience physical dating abuse in a single year. Nearly 1 in 3 teens report sexual abuse, physical abuse, or threats of physical abuse. And this data comes from a study conducted through loveisrespect.org. And nearly 1 in 2 teens in relationships report being controlled, threatened, or pressured to do things that they did not want to do. 1 in 4 high school students report having been psychologically abused by a dating partner in the previous year. Young women between the ages of 14 and 17 represent 38% of those victimized by date rape. And so that's why it's so important for us to include that conversation of sexual abuse with dating abuse, because they are representing the highest population of experiencing abuse by a date, or rape by a date. And then among adult victims of rape, physical violence, or stalking by an intimate partner, 22% of women and 15% of men first experience some form of partner violence between the ages of 11 and 17 years of age. The survivors through the New Orleans Family Justice Center have expressed that they experienced some form of partner violence when they were in their teenage years and thought it was a normal part of a relationship, and didn't realize until the abuse got worse and they were in their adult relationships that this was considered physical or emotional abuse. In a study conducted by the Center for Disease Control called the Youth Behavior Risk Surveillance, Louisiana holds the highest ranking of teens who experience physical dating violence compared to nationwide. Louisiana is at 15%, and national statistics are at, or the average of national statistics are at 10% of teens who experience physical dating abuse. And another reason of why it's so important for us to have this conversation. So when we talk about teen dating, we may be asking, well, what does that mean, right? And our adult relationships and adult dating is very different than teens. So for teens, whether they're going to the movies, out to eat at a restaurant, the different festivals and parades that New Orleans is most known for, or going shopping, when we talk about dating, these are all the activities that they partake in, and it doesn't necessarily have to be a committed relationship where we have this role of boyfriend and girlfriend, but whether they're hooking up, getting together, chilling, hanging out, that's their best friend or their bae or tray. That's what we mean by dating among teenagers. And so when we talk about dating with teenagers, I just want us to make sure that this is the framework that we're utilizing, and not the formalized dating that we are most known. And so we have a power and control wheel, and this is a really good depiction of a snapshot of a violent teen dating relationship. And so on the hub, or the outer rim of this wheel is physical violence, and as violent acts, or the threat of violent acts, are what abusers use to get and keep power and control in their dating relationships. And that's really what we've learned over the years, is abuse is really about one person in the relationship having control or power over the other person, when there should be some form of equality and respect. And so at the center, on the spokes of this wheel are tactics that are used by abusive people to gain power and control in a relationship. So we have things like emotional abuse, using social status, using intimidation, minimizing, denying, and blaming the abuse on the person who's really not at fault. And I think we've gotten to a point where we live in such a victim-blaming society, where we're blaming the person who's really not at fault for the abuse, instead of blaming the person who is truly at fault, which is the perpetrator. And then making threats, and whether they're physical threats or verbal threats, sexual coercion, manipulating or making threats to get sex, using isolation, which is probably the #1 tactic that is used by abusers to gain power and control in the relationship, but making someone feel bad or guilty about wanting to hang out with friends or family, or engaging in different activities after school, whether that be on the cheerleading squad or the football team or on the chess club. And then peer pressure, threatening to expose someone's weaknesses or spread rumors. And so just to kind of give you guys the actual definition of dating violence, and this particular definition comes from current legislation, Louisiana legislation, and it's a pattern of behavior where one person threatens to use or actually uses physical, sexual, verbal, or emotional abuse to control his or her dating partner. So I just want to highlight a pattern of abusive behaviors. It's not something that happens once and it goes away. When it comes to physical and sexual abuse, if it happens once, it's abuse no matter what. But of course, if you see a pattern of these abusive behaviors, it's definitely considered dating violence. And when it comes to emotional and verbal abuse, maybe the first time it happens, if it happens once, we may not consider that as a violent relationship or an abusive relationship, but it can kind of be one of those red flags that lets us know that if it happens again, then it would be considered as abuse. And so when we see a pattern of emotional and verbal abuse happen in a relationship, we know that it's definitely abuse or dating violence. And so there are different types, as we just mentioned, of abuse that happens. Physical, which is the most obvious form of abuse that happens, is any intentional, unwanted contact with a person's body by either the abuser or an object within the abuser's control. And so that some examples of that are scratching, punching, biting, kicking, throwing objects, pulling hair, choking. In the state of Louisiana, choking is a felony crime. Pushing, slapping, using a weapon, and going back to throwing objects, whether it hurts that person or not, or whether it bruises the person or not, is still considered abuse. Slapping, using a weapon, holding someone down, and on high school campus I see a lot of pinning someone against the wall or grabbing, right? And those are all considered forms of physical abuse. And then moving on to verbal and emotional abuse. It's anything that the abuser says or does that causes a person to be afraid, lowers their self-esteem, manipulates them, or controls their feelings or behaviors. So some examples of that are name calling or putting someone down, yelling or screaming, intentionally embarrassing someone in front of others, whether that be your friends or their family members or just the general public, telling you what to do, making someone feel responsible for the abuse, stalking and threatening to commit suicide in order to manipulate a person. Again, we see threats, making those threats, threats of violence, whether it's verbal or physical, and threats of violence and harm to the people that you care most about, using isolation, and digital abuse. And digital abuse is verbal and emotional abuse, but perpetrated through the use of technology and social media. So that could include constant calling and constant text messaging, posting online negative comments, exposing someone, whether it be their secrets or private pictures that maybe you sent to your dating partner. And then sexual abuse is any sexual behavior that is unwanted or interferes with a person's right to say no to sexual advances, forcing a person to engage in a sex act when he or she does not or cannot consent. And so some situations where someone cannot consent to sex are if they're underage, if they're under the age of 17, they do not have the ability to consent to sex. And someone is under the influence of alcohol or drugs. And I've heard teens say, well, someone's drunk. Well, and someone doesn't even have to be drunk for them to not be able to consent. If someone has some form of drug or alcohol in their system, they do not have the ability to consent to sex. And when we say consent, we want to hear a clear, confirmed yes. What I like the things that you're doing, the things that you're doing okay. Yes, I like you to kiss me here or touch me here. And then someone cannot consent to sex if they are unconscious, which includes if they're sleeping or if they're passed out, whether it be from a drug or from being choked or what have you. And some examples are rape, unwanted kissing or unwanted touching and grabbing and fondling. And recent legislation has included even touching on top of clothes as being a form of sexual abuse. Forcing or pressuring someone to go further than they want to, even if they've had sex before. And that can be verbal persuasion, using coercion, manipulation, making someone feel like they have to have sex. I thought you loved me. I thought I was important to you. And then restricting access to birth control or condoms. And so I briefly mentioned some red flags and warning signs. And these are things that lets us know that we may be in an abusive relationship, or a teen that we're working with may be experiencing abuse or perpetrating abuse on their partner. And so for people who may be experiencing abuse in a relationship, some warning flags include losing interest in activities that they used to enjoy. So no longer participating on the flag twirling team or the football team or basketball team. They stop seeing or hanging out with their family and friends, and really that's part of the guilt factor of not hanging out with these people or maintaining these relationships with these important people in their life, laughing off their dating partner's violent behavior. So we may have heard they laugh to keep from crying because they know that the abuse is wrong and they don't want to experiencing it, but some of us try to save face. They're distracted when spoken to or are quieter than usual. They're constantly checking their cell phone to and get upset if someone tells them to turn it off or if someone takes it away from them. And so some people who are being abused, if they don't answer that cell phone or respond to that text in a timely fashion, then they may be punished later on if they don't do that. They're angry or irritable when asked how they're doing. They have unexplained scratches or bruises, right? Or the story just doesn't make sense for whatever the bruise is. And if they're scared of their dating partner, right? They seem to feel like they have to walk on eggshells or look behind their shoulder if they see their dating partner approach or if they come up to them. And then red flags for people who may be abusive to their dating partner is when they continually tell their partner what to wear, where to go, what they can do, who they can be friends with. They're constantly checking their dating partner's phone or social media pages and become enraged if they don't respond immediately every time to those text messages or phone calls. They frequently use drugs or alcohol. They have male influences that show disrespect for women, or they have female influences that show disrespect to men. They use anger or intimidation to get the things that they want, and they have witnessed or experienced verbal, emotional abuse in the home. And so research has shown that people who experience abuse in the home, if they're female, they're more than likely to grow up and date someone who's abusive to them. And if they're male, they're more than likely to grow up and become abusive to their own dating partners in adult relationships. And then if they're frequently impatient or angry at little things, right? And so I'm going to pass it on to Kendra, who's going to share with you guys a study that they've conducted.
Great. Thanks so much, Jennifer. Yeah, so we've heard about what dating violence is, and we've seen statistics about it being a very common and serious issue. So at Tulane and LPHI, we wanted to hear what young people themselves had to say about this topic. So I'm going to be talking about the Adolescent Mapping Project, which was conducted by the Louisiana Public Health Institute's Family Health Portfolio in 2015. And in Orleans Parish, we conducted interviews with 20 local education agencies, so school districts or charter schools, 19 community-based organizations, 36 healthcare providers, and 41 young people. And so that's the part I'm going to focus on today, is what we heard from those 41 youth interviews. And I also just want to acknowledge that this was really a team effort, and we could not have done it without our entire staff on the Family Health Portfolio. So we talked to 41 adolescents and young adults between the ages of 14 and 24. And they were identified through community health clinics, pediatricians, community-based organizations, and schools in the greater New Orleans area. And the majority of participants, about 87%, were female, and also the majority of participants, or 72%, were African American. So we didn't start out prompting them to talk about dating violence or sexual abuse. We really just wanted to hear from them, what did they think were their biggest health issues? And the most commonly reported health issues were reproductive or sexual health issues. So some type of sexual or reproductive health issue was mentioned in every single interview that we conducted in Orleans Parish. And the specific concerns ranged from pregnancy prevention to sexually transmitted infections to sexual violence. So the primary health concerns listed by the young people were pregnancy prevention, sexually transmitted infections, sexual violence and abuse, mental health, and finding qualified doctors. So several informants identified dating and intimate partner violence as a serious health issue faced by themselves and their peers. And male and female informants noted that sexual violence and abuse, particularly in the form of dating violence, has become normalized among their peers, while simultaneously acknowledging that this type of violence is still a stigmatized issue. So we heard from them that it's something that's almost normal. People just accept it now. I'm not saying that it is right, but it's becoming the norm. It could be both physical and emotional. A lot of males tell females what they want to hear just so they can have sex with them. After that, maybe he will not be abusive like a full-on fight, but shoving her or pushing her, and nobody would say anything about it. They would try to keep their business to themselves. It happens a lot outside of school. So we heard that teens don't talk openly about sexual violence and abuse to parents or even to their peers. One informant noted, "I think they feel like pregnancy is more open. It's a natural thing. I don't think they realize how much people go through with abuse because nobody really speaks about it. They don't think about it, but if you get pregnant, a lot of people will talk about it. They feel more comfortable." We also heard stories of unwanted sexual intercourse and young people not knowing whether it counted as consent or what they should do about it. And so one respondent said, "So many of my friends have been like, I don't know if it was rape." And I was like, it was rape. If you were unconscious or too drunk, you were raped. I think what was never touched on is what to do afterwards. And this theme of not knowing what to do was really prevalent in everything we heard from them. So adolescents and young adults felt ill-prepared to respond to those experiencing dating violence, sexual violence, and abuse, whether it was themselves or a friend who was experiencing that. So one informant shared this story about her frustration, and so she had a friend who was in a violent relationship who wanted to get out but didn't know what to do. So this young woman spoke to her mom and told her about her friend and the issues, and her mom told her, "Don't worry about it." But the young woman felt that her friend needed help to file a restraining order or to do something, but that no one really seemed to be responding in the way that she wanted and that she didn't know what to do. So what we found was that dating violence was very common and that it was normalized but stigmatized at the same time, and that young people don't talk about dating violence with adults, with their peers, and that they don't know how to respond or get help if they or a friend are experiencing dating violence. So now I'm going to pass it over to Dr. Aubrey Madkour so that she can tell us about what teens had to say about sources of help for dating violence victims.
Thank you, Kendra. So today I'm going to be sharing the results of a qualitative study that we conducted in the 2013-2014 academic year. And this study was motivated by findings that we had in a quantitative study. We analyzed the last round of the Youth Risk Behavior Survey data for the city of New Orleans. The last time that was a citywide survey was in 2007. And what we found is there was a much higher prevalence of dating violence, and that's specifically physical victimization, in New Orleans compared to both Louisiana as a whole as well as nationally. The prevalence estimated in the New Orleans area was 22%. So that's twice national average. So after that, we wanted to speak with the teens directly about their perceptions of the teen dating violence problem here, including what resources teen victims may have. Before I go any further, even though it's just my name up on this slide, this was definitely a team effort with folks at Tulane as well as LPHI very involved in the design and execution of this study. And we definitely could not have done it without the generosity and time of the administrators, staff, and students of the school where we recruited schools. So we recruited 38 African American adolescents between the ages of 13 to 18 years in 2 public charter high schools in New Orleans. We ended up with 18 males and 20 females, so roughly equally split by gender. We conducted 1-hour in-depth interviews on the school site where the teen was located. We covered the 4 main topics that are listed here on the screen, but for the presentation today, I'm really just going to focus on one of those sections, which was the sources of help for dating violence victims. We recorded all of the interviews, had them transcribed, and then conducted thematic content analysis. So within this subsection, we first asked participants a broad question about who teens would go to for help if they were experiencing dating violence. And it's important to note here that this was a broad general question about teens in general, not directed at what they have done. Because of certain ethical issues, we couldn't directly ask teens if they had been victims of abuse before. I can get into that in the Q&A section if anybody's interested, but this was a general broad question. So with that open-ended question, 24% or 9 participants admitted that they didn't think teens would seek help from anybody. And we saw 2 main themes and the reasons why they thought teens would not seek help. The first was the idea that teens can handle it on their own. They didn't want to involve others in their relationship, and that they felt everybody should mind their own business. And this issue of privacy comes up a lot in different ways when we're talking about seeking help for dating violence. The second theme was about unwanted responses from family or friends, and those included overreaction from parents or family, such as retaliation or seeking retribution, or even telling them that they couldn't see their boyfriend or girlfriend anymore. Unwanted responses from friends were more about judgment. For example, one female participant said that her friends might make her feel stupid for letting something like this happen. And these quotes emphasize the feeling of privacy and embarrassment about personal relationships and feeling like there's no one that can help in such a personal situation. So in the first quote, I don't think they would go to anyone for help. Who would they go to? That is the question. They may not have a support system at all, but if they were to go for help, I don't know, I don't think that, I think that a mother maybe, or friends, but they probably won't do much. So this was another concern that was raised, that even if they sought help from someone, that person wouldn't necessarily know what to do. In the second quote, I don't know if they go to anyone. Hopefully they do, but if they did, I guess they would go to the counselor, like talk to their counselor about the situation. And 9 times out of 10, they would have to report it if it's physical or mental. And a lot of times, girls don't want that. Anyone, guys or girls, don't want their relationships to be reported. Who wants their girlfriend or boyfriend to be reported if they hit them? So they probably will keep it a secret. When teens did bring up sources that they might go to for help, the number 1 source was friends. And you can see 78% of participants reported that. And in the quotes that are on the screen, you can see how strongly teens feel about friends as their primary source of help. Their friends are the first person they tell before they tell their mom and their daddy, auntie, whoever. They tell their friends first. And then the second quote, friends, I don't think they will feel confident enough or they won't feel right telling their parents or basically any adult because they don't want to be looked down upon. So we asked a follow-up question of these participants about what ways friends help, and the most cited type of help was to give advice or comfort. Very few respondents reported that friends would actively involve an outsider. We then asked another follow-up question about how effective they thought friends help could be, and while over half said that friends help can be effective, a large portion, over 1/4, said that friends were ineffective, and also a small number said it really depended on the situation. So the second most common reported source of support was family, and this was about 43% of participants. And although family members were also expected to give advice, similar to friends, there was a greater expectation that family members would have an active response to the dating violence, such as involving the criminal justice system or retaliating. And this quote illustrates that point. Because if you're explaining to your family that this is happening, your family might be like, no, we ain't having that. They'll take it in their own hands instead of letting you deal with it, instead of letting you go about it in the way you see fit. Instead of giving their advice, they want to act on it. In comparison to friends, family responses were less likely to be viewed by teens as ineffective, but also a larger proportion of teens reported that the effectiveness of help from family would depend on the situation. And this is somewhat not unexpected given the potential for retaliation. Much fewer students, only about 1/4 of respondents, spontaneously mentioned teachers, counselors, or other adults as sources they would turn to if they were experiencing dating violence. We didn't get many responses on the perceived effectiveness of these sources, but some participants did mention that the way they would help is by giving advice or telling someone else. And interestingly, there was a subset of participants who felt that there potentially was a broad network of help for teens that were experiencing dating violence. So this quote reads, I mean, you have your parents, your grandparents. If you were at school, you have your teachers or counselors, all the faculty and stuff. Like here, we are a family. So I am more than sure that if that was ever to happen, they will tell somebody, whether it was a student, a parent, or a faculty staff member. And this was definitely a minority opinion among our respondents, but it was not just one person who had this perception. So in addition to the more open-ended questions, we had some more directed questions about the school-based health center. Each of the schools that we included in our sample had a school-based health center on site. The first question we asked was geared towards whether teens would respond truthfully to school-based health center staff if asked a screening question about teen dating violence. And the top text above the table is somewhat how this question was worded. And as can be seen here, many teens felt hesitant about disclosing teen dating violence to the staff in the health center if they were to be experiencing it. Concerns about whether other people would be told, including parents and police, were the primary determining factor for this hesitation. And the first quote here illustrates that concern. No, because they wouldn't want, either they wouldn't want the person to get in trouble or they wouldn't want their parents to get involved or know what's going on. We also asked students about how they would want the school-based health center staff to respond if they did tell them about dating violence. The top responses are listed here: sitting and talking kindly with the teen, provide the teen with resources, and keep what they say confidential. A couple of respondents reported being unsure what they would like for the staff to do at all. But again, in this section, teens expressed concerns about keeping relationship matters to themselves and not having adults involved. So this is a rather long quote, but I think that it expresses some important concerns young people had. talking about experiences and helping, but not taking such action that is going to go, the person is going to feel like you are messing everything up. They're going to go tell their friends what happened. And if that's happening to their friends, they're not going to tell nobody. They're just going to get abused. That's why most people keep stuff in. These teachers and counselors know too much. So it would be really important to reassure the teenager that they are not going to tell everyone else and it is just going to stay with them. This idea or concern about staff and faculty gossiping among one another about teens, not in a way that's sharing information in order to help teens, but purely for the purpose of gossip, was a concern that was raised repeatedly. So lastly, we asked students about what school-based health center staff could do to make teens feel more comfortable disclosing dating violence, even if they were experiencing it. So the most common response here was teens being unsure what the staff could do, followed by being more relatable and ensuring confidentiality. And here's a quote. "I would want to hear if it was me and I was getting abused. Maybe they would say, I can get you some help with this, maybe some therapy, someone to talk to and see you, how you feel, to check you, see if anything is wrong with you. Maybe like, well, it depends on what it is. If it's something that is kind of at a small level, it is confidential between us. But if it's a high level that happens over and over, you can talk." So in summary, we found that teens' most likely source of help is friends and or family, which is very consistent with other studies that have been conducted in other locations. Victims, teens felt, were unlikely to seek out help from sources that may get others involved, such as the police or social services, but teens viewed sources that do not get such outside people involved as less effective. Excuse me. The young people also expressed reticence with going to school or school-based health center staff due to confidentiality concerns. They were worried about staff spreading their business to others in the school, as well as a desire to keep outside authorities uninvolved. So I will go ahead and hand this back to Jennifer.
Hi. And so we just heard about some barriers to reaching out for help and some really good suggestions from teenagers. And now I'm going to talk about some current legislation that might provide a platform to encourage teens to reach out for help and share some prevention services that the New Orleans Family Justice Center has to offer. So just to kind of briefly go over the legislation, in 2010, it was written into legislation that mandated education for students. So all public school students enrolled in health education classes in 7th through 10th grade have been required by law to receive dating abuse prevention instruction. It has to be grade or age appropriate, and it must include the definition, some warning signs and red flags, and some characteristics of healthy relationships. Well, in 2014, they decided to expand that legislation to include employee training. And so legislation mandates that all public school personnel, and this is anyone who has contact with students, from the janitor to the social worker to the principal, must receive an annual training at the beginning of the school year on the definition of dating abuse, the warning signs, and a response to teen dating violence and what that looks like. It also includes parental involvement. While it doesn't mandate that parents receive education, it does mandate that the school provide the parent with information on dating violence. And then it also includes school tracking. So schools must track incidences of dating abuse. They must collect and represent the number of incidents reported to school employees, and include actions that were taken on those reports. The superintendent must make an oral report each spring to the school's governing authority, and the school must include in their student code of conduct dating violence definition, the warning signs, and reporting instructions. So the New Orleans Family Justice Center has developed a response, a policy that assists schools in the response of dating abuse incidences. And we can definitely provide that technical assistance to schools to be able to implement that and ensure compliance of a mandate. And so there are some legal rights for victims of dating violence who are teens. In Louisiana, minors under the age of 18 can obtain a protective order, which is an order that requires one person to stay away from the other, and the intention of the order is to prevent abuse and increase the safety of the victim or survivor and decrease any danger that they might be in, and of the person who is seeking the court's protection. And so these orders can be issued by a civil court, a juvenile court, a family court, or a criminal court. And our agency, the New Orleans Family Justice Center, provides that service free of charge. The only glitch or the catch is state law does require that a parent or adult household member, and this must be a legal guardian, to petition for the restraining order, the protective order, on behalf of that minor. And so it's important for us to check our school's guidelines on enforcing these protective orders. The school must be in a position to enforce them. The student must provide that to the school. And just thinking of ways to enforce those protective orders, it could mean changing a class schedule to make sure that the students aren't in the same class together. It could also mean them having separate lunches. So instead of A lunch together, one has A lunch and the other has B lunch. So just thinking of ways to enforce that protective order on behalf of the student who sought the protective order. And I'm not going to go completely over the safety planning guide, but this is something that we conduct with every survivor that comes through our agency. It's really just thinking of ways that we can increase an individual's safety and decrease their danger, similar to the protective order, but just thinking of ways to stay safe at home, staying safe at school, staying safe within the community, and staying safe emotionally, which I think some of us don't always think about, but thinking about what does the abuser say or do to try to make a person feel bad, and what are some things that you can do or say to yourself to kind of contradict what they're saying to that victim. And then just other things to think about. Think of things to do to help keep you safe every day. Think of things that the team can do to help stay safe in their social life, so that this doesn't happen again. And think of some things that they can do to stay safe while online or using cell phone. We know, we mentioned digital abuse briefly, but we know that, I mean, that's a contact with the world using the cell phone, and abusers try to perpetrate abuse through cell phone and social media. And so just thinking about ways that we can increase our safety through using those platforms. And these are just some ways that the Family Justice Center can get involved in providing prevention services. We provide workshops, assemblies, and presentations to schools using evidence-based and informed curriculums, safe dates and up standards, some that aren't listed, courageous kids, coaching boys into men. And then we can also provide professional development for school personnel. And it's really a customized training that's in compliance with mandated legislation that we just mentioned. And we can also provide assistance in developing a policy for schools and responding to incidences that occur on the school campus. And also provide technical assistance in providing verbiage to include in the student code of conduct for the school. I do want to highlight that anyone can experience abuse in relationships, regardless of a person's gender, sex, race, their socioeconomic status, their exposure to violence in the home, or their experience in dating. Anyone can experience abuse, whether they're in a heterosexual relationship or a same-gender relationship. And unhealthy relationships can start early and last a lifetime. I think a lot of things that teens experience in relationships, they think it's a normal part of a relationship, but it's actually not, and it can develop into more serious forms of violence. And so some areas where teens can get help, of course, contacting the New Orleans Family Justice Center We do have a 24-hour crisis line, 866-9554. I tell people when in doubt, call 211 and they can connect you with our information and phone number. And then Lovers is Respect is a really good website. It not only provides a 24-hour crisis line or hotline for teens to reach out, but it also provides texting and chatting services with their peers who can help them kind of gain some clarity on their relationship. But it also has really cool quizzes that teens can take to see if they're in a healthy relationship. And as parents, it has, and professionals, it has quizzes to make sure that we are having that open dialogue with our teens. And then the New Orleans Children's Advocacy Center provides information and services for anyone under the age of 18 who's experiencing abuse or sexual abuse or rape in their relationships by conducting forensic interviews and exams. And then the New Orleans University Medical Center steps in for teens and adults ages 15 and up. And we want to make sure that we are advocating for teens to just be healthy in their relationships. And so I'm going to pass this back on to Kendra and Aubrey. Thanks.
Great. Thanks so much, Jennifer. We just wanted to acknowledge the staff at Tulane, LPHI, and the New Orleans Family Justice Center for their contributions to this work. And we also wanted to thank our funders for their generous support for this work, and to thank the school administrators, school staff, clinic staff we worked with, but most importantly the young people themselves for sharing their time and experiences with us. All right, I'm going to pull up the questions if I can get the mouse to work. Maybe. Okay, I can't get, why is this not working? Sorry about the technical difficulties, everyone. So we have one question so far, which is, are there any workshops around this topic in New Orleans anytime soon? And I'm going to let Jennifer answer that one.
So the New Orleans Family Justice Center is definitely within the community and schools. And we do currently provide this training to high school students, and we're reaching out to teachers to provide their professional development training. But in April, I'm also involved with the sexual assault response team for New Orleans, and we're actually conducting a summit on primarily sexual abuse prevention. It's on April 18th at the Multipurpose Center in the Lower 9th Ward, the Pete Sanchez Center. And so if you go on our website, just visit often and you can learn more about the programming and education and workshops that we'll be providing. But it's a full day workshop. It costs $10. But if you're interested in obtaining continuing education credits, it'll be $15. So www.nofjc.org. And we'll be posting information soon on how to register for that. Thank you.
Great. Thanks, Jennifer. So we have another question that says, is there or are you working on a judicial bypass whereby youth could petition the court without parental involvement?
It's really great that you even asked this, because I was just, I addressed the city council this morning and brought this up to them, that this is definitely a barrier for students who wish to obtain a restraining order but don't want to involve a parent. We're looking to be able to change some legislation around that, and we've been working with the Louisiana Appleseed Network to provide some verbiage on how we can go about that. And then United Way is one of our partners in advocating again for policy changes for this. So we'll keep you posted, but we've started the conversation, and just make sure you're on the lookout on any additional information on policies. And then the next question?
That was what your website is, which you already
Oh.
answered.
Yes, the New Orleans Family Justice Center website is www.nofjc.org. You can even Google New Orleans Family Justice Center, and it'll bring you to our page. And there's a lot of information as well on the services that we provide and the curriculums that we utilize under the Children's Services section of the website.
One thing I wanted to bring up that wasn't in the presentation anywhere is that the results from the study that I spoke about today have been published in the Journal of Interpersonal Violence, and if anybody is interested in receiving that write-up, you can feel free to email me and I'll be happy to send you a PDF of that article. And my email address is up on this question slide right now.
All right, we have another question, which just says it was very informative and they're going to be in touch. Thank you so much for that comment.
Thank you.
Do we have any other questions? And if you think of something after the webinar ends, please feel free to contact any of us. And keep an eye out for an email with some follow-up information. I'll send a copy of the slides and the link to the report about our adolescent mapping project, as well as a link to a survey where you can provide us with some feedback on the webinar. So any other questions? Great. Well, thank you all so much for your participation today. And please keep an eye out for that evaluation that you'll be getting in your email.